Well, hello and welcome to NextGen Healthcare Solutions webinar. Today we're going to be presenting Immunizations A to Z, which of course covers everything from administration to Z23. We wanted to give you a heads up that due to the detailed nature of the Immunizations module, the presentation itself will likely run a little over an hour, and then we'll answer questions at the end. So don't worry if you have to leave before the end of it. We're going to send out a copy of the slides and a recording in an email tomorrow, and the recording will include answers to all the questions that you ask. So my name is Chelsea Grover, and I'm the Marketing Communications Coordinator for NextGen. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with NextGen, I'd like to share a bit of who we are with you. We have been in business as NextGen since 2003, but we were NextGen users since 1997, EPM version 2.3. We specialize specifically in NextGen Healthcare. Our development team knows how to get data into, out of, and around NextGen to customize it and tailor it to meet our clients' unique needs. Our purpose in life, the reason we exist, is to create delighted clients by helping them get the absolute most out of their NextGen software investment. It's our passion to provide solutions for our healthcare provider partners, which in turn help them to provide patient care, enhance the patient experience, and maintain a financially healthy practice. We really do everything NextGen, from consulting to hosting to customization to support, and we have two NextGen add-on products solutions for ChartGuard and Refund Manager. We're here to help. Next, I wanted to bring your attention to some of the upcoming webinars that we'll be offering. On February 3rd, we'll be digging deep into the meaningful use, public health reporting, and hardship exemption clarification. In it, we'll look at how to achieve registry reporting, public health recording exclusions, and hardship exemptions, as well as the future of meaningful use and overall program updates. Future webinars will also cover NextGen Share in the Real World, the steps to a patient-centered medical home, and quality care program reporting. You can either register now on our website or keep your eyes out for the webinar invitation email from us. Okay, so back to immunizations. At the end of our presentation, we're going to open the floor up to questions from you. We're going to answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. For your reference, we'll also be emailing out links to the recording and PDF of the presentation as we do later this week with every webinar. Finally, for audio clarity purposes, everyone's phone will be muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today, Jeannie Logue and Sue Campbell. Jeannie Logue has been in the industry for over 25 years and is the Director of Consulting Solutions at NextGen, and is one of our leading experts. You've likely heard her speak before, either on previous webinars or in person at UGMs and MGMAs. She's worked here for over 3 years and lives and breathes the industry, travels across the country seemingly nonstop, working with our clients at their locations. Sue Campbell has worked in the healthcare administration and IT for over 30 years and has been with NextGen for the last 9. She supported NextGen since 1998 and has experience in both EPM and EHR, and currently does interface and upgrades. Her work with the immunization registry interface led her to dig deep into setup issues when immunizations moved from templates to the order module. She'll be here to help answer questions at the end. Okay, so Jeannie, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Welcome, everybody, and thank you for taking time out of your day today to attend today's webinar. We have a lot of material to cover, as Chelsea mentioned, so please submit any questions that you have through the question box, and we are going to go ahead and answer all questions at the end of the webinar. Your questions are very important to us, and hopefully we can get them all answered throughout many slides here before we get to the questions at the end of the webinar. So getting started, immunizations A to Z. The agenda for today's webinar is why we did the move to the module from the template. We're going to talk a little bit about CVX codes, VFC, which is the Vaccines for Children, file maintenance, the workflow in EHR, the actual sub-navigation links to the immunizations, take a look at crystal reports, looking at new inventory in your Ngkbm immunizations, looking at inventory reports and your reconciliation of your inventory, mapping vaccines if you still haven't taken the time to actually map the old historical vaccines. We're going to look at administration codes for the billing, and then last but not least, ICD-10, the new code for vaccines is Z23. So first off, why did we move from the mod? Why did we move to the module from the template? In 5.8, when everybody moved to the 5.8 upgrade in 8.3, to meet meaningful use stage 2 guidelines and the reporting that was necessary for this, NextGen had to move the immunizations into the actual orders module. This allowed them to be able to generate the CCDA documents in the proper format that was required. So immunization registry submission also requires an interface and successfully submission for the entire reporting period. So many states require the registration prior to the reporting period. So if you're not already doing this, start planning that and coordinating that as well too. So the whole purpose was the templates were not going to allow us to be able to meet the meaningful use stages and the requirements for all the reporting. So it had to be moved into the orders module. Version and hotfix still matters. You know, it was the 5.8.8.3 upgrade when we moved into the module, and right now the immunizations have taken on a couple of different functions. So for everything to function properly, it's recommended that you're at least on 5.8 UD1 hotfix 69 at minimum. Now you may still be on 5.8, not UD1. You can still use the immunization module. You may be having a couple of different issues that other people are not. So we're going to kind of talk through, you know, if you've got your setup completely correct and you're still having issues and you're on 5.8, not UD1, on what can you do? Can you reach out to NextGen? Is there a way to get all the information you need for immunizations without having to go to UD1? So CVX, first of all, I want to talk about CVX codes. The CVX codes are very, very important within your immunization setup when you're setting up your actual inventory. All CVX codes must be entered correctly, and every vaccine has a CVX code listed. These are actually the uniquely identified for each vaccine, and in earlier versions of Ngkbm and the custom templates, they were often missing the CVX code, which is causing what we see the unknown vaccines in there. Or if you have inventory that you're not able to see within the EHR system, it could be because the CVX is incorrect or missing. So if you are unsure what the correct CVX code is, refer to the CDC's website, and I've listed that below. So at the bottom, when I looked at this, I mean in your orders detail, and we're going to look at your inventory, the CVX code is very important that it is accurate, it is correct, and it's on your inventory. So the VFC for vaccines for children. Some of the offices are using this, some of the offices are not. So I just wanted to go over a little bit what the VFC program is at a glance. It's the Vaccines for Children program that helps provide vaccines to children whose parents or guardians may not be able to afford them. This helps ensure that the children have a better chance of getting their recommended vaccinations on schedule. So the vaccines are available through the VFC program, are those recommended by the Advisory Committee on the Immunization Practice. So any practices that are doing the VFC program, the funding is through the Office of the Management and Budget, the OMB, and they're allocated through the CDC, or the Centers for the Medicare and Medicaid Services. Excuse me. So in turn, if you are getting the VFC and you have the funding, you want to make sure that your vaccine inventory for these are up to date and your records are accurate, because you need to report these to them to continue to get your funding for the VFC. So now we're going to jump into file maintenance first, and I've kind of prepared the slides a little bit, breaking them into categories so that we can walk through each step of it. There is a lot of information in the setup. There's a lot of information as far as in the maintenance of your inventory as well. So there's the build and then there's the maintenance. So I want to start with file maintenance. So within file maintenance, we have a couple of sets of orders here, or a couple of sets of things in file maintenance that we have to make sure that we at least touch to make sure that everything is going to work properly. So the vaccine orders is now called vaccine inventory in 5.8 UD1. So if you're still on 5.8, you're going to see it say vaccine orders in file maintenance, not vaccine inventory. The VIS Set Up, the vaccine billing, the practice preferences, which is on the orders tab under the immunization piece, the vaccine relationships, and your VFC reasons. And all of these need to be touched for your immunizations to work, especially if you're giving the VFCs as well. So the first one we want to take a look at is your actual vaccine inventory. So within the vaccine inventory, when you did your upgrade, all historical inventory was visible in file maintenance, and it was considered active in file maintenance. So anything that was historical from your system practice template immunization inventory is now brought over into file maintenance. What this has caused is a little bit of a mess, okay, and it needs to be cleaned up. So what we noticed is that when you first go in here, a lot of these are missing your CVX codes, and we're going to talk a little bit about that. But you're going to see a lot of inventory that is no longer active inventory, but it came into file maintenance as active, not inactive. So these are critical to maintaining your inventory. So we're going to look at a little bit of how you clean that up first. So the first thing we want to do is if you open up anything in file maintenance, it's going to show active, but if you look at the order details, you very possibly could see where it says status inactive, or even status of D-2011 or some other random numbers in here. Those all have to be made inactive and hid, because they're never going to show up in EHR when you're trying to find those lot numbers. So we have to actually rebuild them and make them clean inventory. So when I say make inactive and hide, if you actually just go and hide these, they're still going to be active. So there's a little in the middle of the screen here, we've got the inactive checkbox. So you've got to make sure that you click on the inactive and then hide it. Don't just hide it without making it inactive, otherwise it's still going to show up in your inventory. So under the active inventory, the things that are required, and these are defaulted from when you actually choose the vaccine to start building your inventory, but the status is going to be active. Your procedure code is also going to pull in. Your procedure description is going to pull in. Your CVX code, and then your CVX vaccine name. If any of these are missing or incorrect, then you need to basically hide that inventory and build from scratch, build from new. So again, make those inactive and then hide the ones. So below I just have one where, you know, you look at it and you open it up and it may say active and it may actually have a date on there that's not expired until, you know, 2016. But if the CVX code is 0 and the CVX vaccine name is no CVX assigned, that actually is bad inventory. That's one of the historical ones that's missing the CVX number. And then it's not going to be represented in EHR when you go to choose that lot number. So if your inventory has never been cleaned up and you go into file maintenance and you're seeing all your historical in there, it is much easier to actually make those all inactive and hide them and start brand new. That is what we recommend. And if you've got anybody that knows SQL, they can run a SQL script and basically, you know, click on that to all inactive and hide them all, and then start building your inventory from scratch. It guarantees that your inventory is clean and that you're not going to have any issues with it. So the first thing you want to do is you're going to click New, and then you're going to choose your vaccine. So the vaccine inventory that you're going to see here is every vaccine, and it's updated from the first data bank. So when you do your med updates, you want to make sure that you're doing your med updates on a regular basis. And what it's going to do is going to pull in all the new vaccines that are out there and available, and you're going to build your inventory from this. By clicking on these and pulling it in, you're going to guarantee that your status is active, your procedure code is the correct one, your description is correct, and your CVX numbers are accurate as well too. So it is important to do this, and we're going to talk a little bit about flu vaccines and why making sure your inventory for flu vaccines are pulled in and built new every year, because the actual information and the NDC numbers can change. So once you build the new, it's going to pop up the order details for you. The more information you enter here in file maintenance on the orders, the less you have to do when you actually give this vaccine in EHR and you actually administer it. So, you know, you've got your procedure code description, and that top part you cannot change. But now you've got a vaccine name, your strength, your quantity, your route of how you're giving it, your manufacturer, your NDC number, the components that are within that vaccine. So if it's a multi-component vaccine, you want to make sure that you actually take those components and make them 2 or 3 or whatever the components are within that vaccine. That is going to trigger your administration billing codes when we look at that at the end of the presentation. If you're billing with one component and it's a multi-component vaccine, you're probably going to be billing it incorrectly as far as the vaccine administration. So make sure your components are correct as well too. And then your expiration date and your starting units and your lot numbers, those 3 are extremely important as well, but they're going to vary based on every inventory that you build. So I may have multiple Hep A inventory, and this one may be for my location of Atlanta Medical Group, and then I'm going to build another one, my Hep A, and I may link it to my main office. So everything else is going to stay and be the same for every inventory, but my lot number, my expiration, and my starting units and ending units are going to be different. The one thing we want to look at as well too is linking the actual inventory location. If you have one location and you link it to the practice, then you're fine. But if you have multiple locations and you don't link the inventory to a location, again, when you're trying to pick that lot number and the actual administering of it, you're not going to find the lot number. So the location really does matter. So you want to make sure that you link these to the right location. Now, again, the other thing with linking it to a location, if you get new inventory in and you're not sure what location you're going to send it to yet, but you want to go ahead and load that inventory in file maintenance, you can, just don't link it to a location yet. And then once you deliver it to that location they're going to use, then go back and actually link it to that location. The only thing that's going to save you is it's not going to be on their drop-down list until you're ready for them to see it and use it. So as we're still building our inventory, a couple of little tricks that we've worked through as well. If you are giving VFC or you have multiple locations, what we've been suggesting that the offices do is under the brand name, which is not going to print anywhere or go anywhere, you can go ahead and put VFC either in front of it or behind it, which is going to be a visual for you. And then when you're in file maintenance and you're looking at all your inventory, if you put VFC and then the brand name, you can sort and see all your VFC inventory. And then we have some practices that are also using the location. So when they pick location at the top in EHR, when we get to actually administering it, then we can say, oh, I was on the wrong location, and that's why I'm not able to find my lot number. So if you're ever trying to administer something and you're not finding the lot number in your drop-down, you need to go back and look at where is it linked, what location can you use it at, and then is it VFC or is it not VFC, because that's all going to drive where the lot numbers populate when you're on the EHR workflow. So if I build my first inventory and it's clean and I've got multiple lot numbers now with multiple locations, so I want to go ahead and continue to build additional TDAPs. So if I build my first TDAP and I've got everything entered nice and clean, I can right click on my TDAP and I can just say copy. And what it's going to do is allow me to just copy everything that I've just entered, and I'm just going to name it TDAP again. I don't have to change anything. It's going to hold all the information that I have. Now, we are going to talk about how you can add additional inventory in the system practice templates as well, but this is done in file maintenance. When you're building your initial first inventory, I would make sure that you build all of it clean in file maintenance first. So once you actually do that copy, you need to update that copy that you just created. Otherwise, it is just going to be a duplicate of what you just put in the system. So you're going to open that one up, and then you're going to update your lot number, your expiration, and then your starting units and ending units. So what I stated there before is these are the 3 fields that are going to vary on each inventory because they're going to have their own lot numbers, their own expiration numbers. But once you build one clean one, it's real quick to build additional ones and just update that information. Now the location may or may not be the same, so you want to make sure that you change the location as well if that is an inventory for a different location. So under the tabs of the vaccine inventory, there's a lot of questions that come out about the options tab. And the options tab basically will say component lot numbers. So there was some confusion on, do I add additional lot numbers of the same, like DTaP, do I add them in there, but they have different expiration dates and they have different lot numbers, so why would I do this? That is not what it means at all. So the Options tab is actually only used if there's combination vaccines that you are actually shipped separate vials, and then you're mixing them before you're giving the vaccine. So just think of this as kind of a parent-child type of scenario where you have to list all the child vaccines that must be mixed to the combination. That is the only time that you would use this. So you would list out all the lot numbers of all the child vaccines that you're going to mix together that's going to all be within that one administration that you're going to do. And that's the only time you would use this option. Also under the Options tab is the Vaccine Admin CPT code. So the CPT code for the standard admin code is going to auto-populate. You do not need to link the code in here. It's going to automatically, and we're going to talk about the codes at the end of the presentation, it's going to automatically pull the correct code on whether it's the first vaccine, if it's a multi-component vaccine, if it's the second vaccine of the day. It's going to know what to use in the system. Now, if you are giving VFC codes and you cannot bill or you do not want to bill for the vaccine admin code, you can build a dummy code in here, and then you can have it point to that on the VFC so that it prints out, basically it pulls a dummy code that zeroes out and it actually overwrites the generated CPT code that would normally be there. So you're going to build all your initial inventory, like I stated, in file maintenance. It's cleaner, it's easier, and once you build that first vaccine, then we'll talk about how you could add additional vaccines in system practice templates. You can give a user access to vaccine inventory only through file maintenance. So if you have clinical staff that you want them to maintain all your inventory in file maintenance, you don't have to give them rights to everything in file maintenance. So in system admin, you can go in and you can actually just give them rights to the actual file maintenance inventory only. And that way they can go in and keep track of this, maintain it without having access to everything that's in file maintenance. At the end of the presentation, like I stated, we're going to look at new inventory and existing that are already built in vaccines. So one of the things I want to make sure that everybody remembers that if it's a brand new vaccine, you've never given it in your practice before, you can't add that inventory through system practice templates immunizations within EHR. You have to come back to file maintenance. You have to build it the first time within file maintenance because you've got to go to that data bank of immunizations and you've got to grab the right immunization with the right CVX and CPT code. So it has to be built the very first time in file maintenance. So I'm going to talk a little bit about the VIS setup. So the VIS documents are the information sheets that you hand out to your patients when you're giving the vaccines. They are now included in any 5.8 up, 5.8 UD1, 5.8 UD2. They do not need to be downloaded anymore. They actually were in your upgrade and put into a folder. The problem is they do need to be moved. So if you haven't moved them into the correct folder, you're still probably not getting the VIS information sheets that you need. So quickly, I just kind of laid out here that you want to go into your system admin, verify your pathway under universal preferences. So it's going to be under reports, report path verified to the EMR reports. And then you're going to go out and you're going to browse to your NextGen root folder in prod. And then you've got an EMR folder there, a reports folder. And I know this sounds like a lot of information, but you can follow the steps. But you're going to create a new folder called VIS. And then you're going to go to those distributed report folders, and that's the ones that have been downloaded when you did your upgrade. And then you're going to open and copy those and put them in the right drive. And that way, when you go to print these, it's actually going to pull all your current VIS documents for you. So if you're not getting the VIS documents and you're still manually printing them, they are out there in that distributed report folder for you. You've just got to get them moved over into this VIS folder that you create out there on your EMR reports in prod. So another piece that we've seen that people just aren't getting the right VIS because they haven't moved them over. The VIS updates are real time, so anytime you do any kind of version update or you do any kind of update, you're going to get the new VIS updates as well. If you want any VIS for additional languages, you can go out to the CDC website and you can sign up to receive anytime there's an update for a VIS, or you can download the different languages. When you download them and put them in that VIS folder that you created, you have to make sure that you name it in the format that I have here below, and it does have to be all lowercase. So basically you would name it VIS DTAP 061010. So if you are missing one, or if there's one that you need that you didn't have in your original download, you can go out and get that. You just have to rename it in the correct format so that it will actually populate when you go to print the VIS when you're giving the vaccination. So if you open up the VIS setup in file maintenance, you can look and see that all the VIS documents are going to be there. You don't have to update or change anything in there. I've kind of given a little bit of a screenshot of that EMR reports VIS folder, and that's what's going to house all your VIS documents for you on the system. The only time you really need to go in this VIS setup is if you download a brand new one, and then you just need to link it to the vaccine that you want it to print on. So if you're fine and you're not having any issues once you get this set up, you're great. But if you actually have a new one that you pull down in possibly a different language, because as you can see, these would say English, so if you want to pull down the Spanish, you just need to go into, the poliovirus, and then you just need to either link the Spanish and the English so that you have the opportunity to print either one when you give the vaccination. So the vaccine billing, we're going to look a little bit about this functionality as well. We're still in file maintenance. So the vaccine billing, if you open up the vaccine billing list in file maintenance, every vaccine has to be linked to a SIM code. So when we built our vaccine inventory, we had a CPT code linked to it. So now we have to link basically the CPT code to the SIM code. So we have to make sure that we mark one as a default as well. So if you want, or you've already built, you can have a CPT code for the VFC. So in my example here, I have the 90702V for the vaccine for the VFC because I want to document that differently than my 90702 because I'm not going to bill it out to my payer. I can go ahead and link my 90702 CPT code to my two different SIM codes that I built. This is required that you do this on every CPT code vaccine that you have in the system. If you have not linked it to a SIM code, you may be seeing where you're actually administering a vaccine and you're not seeing it cross over. So you're not seeing the billing actually come over into the EPM or even show up in EHR when you hit the submit, or when you close it out, and it should automatically go. And go back and track and look and see in your vaccine billing, are you missing that CPT code? Have you linked it to a SIM? So the next piece we're going to look at is we're still in file maintenance. So we've built our inventory. We've now looked at our VIS. They're all linked to our inventory vaccines. We've looked at our billing codes that are now all linked together. And then we're going to look at practice preferences. In practice preferences, we have an orders module, and there's now an immunization tab as well. So on the immunization tab, you have a couple of options and I broke this down into several pieces here. You've got the option of actually disabling your allergies before you order. So what this does is when I'm in the EHR and I'm actually just ordering it, it'll pop up the allergies at that point. You have the ability to disable it then and then just click on it when you're actually administered it. So this is a practice preference, and it is, across the board practice has to make a decision on when they want that to pop up. The ignore pediatric recommendations for adults, this was new in UD1, so if you're still on just 5.8, you're not going to see this. But basically, it's going to ignore the pediatric recommendations for adults. So anybody that was on 5.8, you were seeing that it was saying something was past due. The person may be 23 years old, and it was still looking at some pediatric recommendations. So basically, it will come out of the box unchecked, and if you want it to ignore the pediatric, it will come out of the box, checked. But if you still want to see the pediatric recommendations, you would uncheck that. So the next piece in practice preferences on the orders module is your default registry. You need to, if you're going to do through the registry, you have to request this through NextGen. You cannot load this yourself. You need to actually contact NextGen, and they will set up your registry and get that all connected for you. The default VIS print mode. So you have the ability on the VIS to prompt you and say, do you want to print this? Do you want it to automatically just go to a printer or none? Best practice is that they will prompt that, and we'll get into actually when we administer this where that actually populates. The other piece is the default VIS category. If you want to set up a favorite category, when you actually print the VIS, it's also going to pull a copy in the chart that you've done this, and if you want to put that into a category, those documents will then all be categorized in that patient's encounter. So again, still in practice preferences, you've now got your vaccine favorites. These are preloaded, and you're going to see pediatric and adult favorites, and you're also going to see like 2 months, 4 months, 11 years old. And basically what NextGen has done is loaded all the favorites that are recommended for anybody of that age. So your order sets are loaded. These can be updated. You can build your own. You can actually create your own category if you desire. So where these are going to show up when we get into, again, the application of EHR and administering, when I go to order, if I click on the 11 years old, anything that's in this box is going to pop up that this is the recommendation for 11-year-olds. So if that's not what you want in that box, then you need to come back here in practice preferences, and you need to remove what you don't want to populate there as a choice. So again, it's out of the box, the recommendations, but they are customized by practice on what you want in that box. Now, if I do create my favorite, I'm just going to go ahead and name my favorite, and then I'm going to pull in, these maybe are the only vaccines that I give. So you're just going to open that up, and when you open the yellow folder, I'm just going to move to the right anything that I want to see if I pick on that category. Now, if I build something and somebody says I no longer want this, you can't delete it, but if I remove everything out of that folder, it's just going to disappear and you would no longer see Jeannie's favorites. So the only way to get rid of them is move everything back to the left, and then when you close out and come back into practice preferences, that new category I built will be gone because I don't have the ability to just delete it. And one of the last parts of the practice preferences then too is the vaccine schedule. So again, a vaccine schedule is going to come pre-built, predefined out of the box, and it's basically just going to say at what age at 2 months the DTaP should be given, this DTaP at 4 months. So it's going to go ahead and build those schedules for you. So when you're looking at something that's past due, when you order, it's going to show you something's past due. It's going to be based on this schedule that's in there. Now, anything that's on the schedule here, like that DTaP that says 2 months, if I go up and click on my category for 2 months, that DTaP is going to be in. So anything billed at the bottom for the schedule is then billed at the top of the category groups as well. Again, your practice can alter these. You can update them. You can make one practice schedule, and then you can copy it from practice to practice if you have multiple practices. Or you can just basically say apply to all practices. So again, out of the box, it's going to be the recommendation, but if you're finding that things look like they're past due when they're not really past due, or they're not past due based on what you want, you just want to take a look at this and make sure that you actually are updated, and it's going to then drop down in the boxes when you order in your category what you want. And then the flu season, you can also chart, your start and end of flu season as well on there. So for an example, when I talk about moving them over into the module, and this piece is probably one of the most important pieces, I think, in the whole presentation, and I'm going to jump back one slide here. When I talked about making sure that I dropped in my category and what I was looking for was in that category. So if I go to the adult and I drop down and I'm looking for a vaccine and I pick the adult and the vaccine I'm looking for is not there and I'm unable to order it, so it's not in my group of favorites. The thing is, we need to make sure that each year that you're doing your flus and you're moving them in under practice preferences. So unfortunately, we set up practice preferences, we pull in our vaccine from our inventory, and we think we're good to go. But what's happening with the flu vaccines now that we're on, the second and 2.5 years into this, the NDC numbers are different. So your CVX numbers, for example, are all 150, 150, 150. But the actual NDC numbers have changed. And the reason they're changes is there are different names for these vaccines. They'll say flu, but if you hover over these, you're going to see they're all a little bit different. As we know, every year the flu vaccines are just a little bit different. So what I need to do is go into my practice preferences. When I build my new inventory for the flu, I need to move over last year's out of my choice, and I need to bring in my new inventory for 2015 or 2016. So again, it's just a matter of opening up that, update my favorite of my category adult, open my yellow folder, and then move over my new one and remove back my old one. Now, it is tough. If you look at the bottom, we're looking at the CVX 150, 150, 150, 150. So you're going, okay, which is my new one, which is my old one? It's not showing me, any more information. It is a little difficult. If you hover over them, it's going to give you the full name of it. You're just going to have to know exactly what your new flu vaccine is for the year to move it over. So vaccine relationships. The vaccine, again, we're still in follow-up maintenance. The vaccine relationships allow you to set up groups of the vaccines to either exclude or display. So basically what it's going to do is the relationships, again, are going to come out of the box. You have the ability to update these or change these, but they are pre-built. And it's going to show you that if I look at diphtheria and it's, I have it displayed, if I go over when I'm in the EHR and I'm actually ordering it, under the polio, it's going to show me anything that has a relationship to polio. So it is going to show my diphtheria and my poliovirus vaccine. So, and then if I look at my Hep A, I've got Hep A vaccine and I've got an influenza one under there. So the relationship, again, matters. So as you're ordering and you're seeing things that when you drop down under the adult category and you see things like Hep A and you've got 4 or 5 to choose from, that's because the relationship over here is built in saying this is, this is the one vaccine, but all these are related to that. So they're all going to be dropped down in that same box of the Hep A. So the exclusion relationships also, we looked and it said display and it also said exclusion. So the exclusion relationship, when we go into the actual application again and we want to exclude something. So if we say the Hep A or something on this one example, we say this influenza is due now. Well, if we want to go ahead and say we want to exclude this, the patient doesn't want it this year. My exclusion that's built in file maintenance, again, is going to include everything that falls within that same category. So when I'm in the actual application again and I want to go ahead and exclude one, and we'll look at that a little bit deeper when we get into EHR workflow, when I say that, it's going to pull up all the relationship underneath that, and I have the ability to say check all, and then it's going to exclude all of them. Okay, so we've got, again, the relationships matter as far as when you do an exclusion, and they matter when you're ordering. Now, if I say exclude all, I could still order that at some point, and at the bottom I've got where once I hit the exclusion and it took the entire group and excluded, it grays them out. They're in a lighter gray, but they're still available, and I can still order them. It's just giving you a visual that at some point somebody did the exclusion on those. So the VFC reasons, so if you are a VFC provider, you're going to get the VFC reasons, which again are critical when you're actually ordering and administering a VFC, because you have to acknowledge that it is a VFC on that order, so that when you're choosing the lot number, it's going to direct you to the file. It's going to direct you to the inventory that you built directly for VFC, because in that inventory we checked this one as a VFC, this one is just a private. So once you actually register with your state, your VFC reasons will go ahead and pre-populate. Okay, these cannot be created without the registry because the VFC code and the coding system are required. So when you see the VO2 and the HL70064, those are required. So even if you're not reporting to the registry, you need to get your registered set up or your registry set up so that you can get your VFC code so that you can actually document on the order that this was a VFC immunization so that your inventory stays accurate. So now we're going to get a little bit into the workflow of EHR. That is a lot of information. It is a lot of setup. There is some pre-built, as you saw within NextGen, but it does need to be maintained. It does need to be looked at for the workflow in the EHR to actually properly function. So in the EHR workflow, we're going to look at a couple of different things here, and we're going to go into the actual orders module under the immunization. We want to look at the VFC versus private. We're going to look at the allergies when we talked about whether it pops up or does not pop up. We're going to look at completing an order and task save or send if you're not administering right at that moment. We're going to then look at actually administering the vaccine, the VSI documents printing, the VFC versus private when you're actually administering it. Whether we have a wasted vaccine, how do we take care of that? We're going to look at exclusions. We're going to look at documenting historical vaccines, and then we're going to look at how you document a series is complete if you're not actually giving that series to the patient. So the first thing we want to do is if we're going in, we're actually just going to do a brand new order. The registry is not required, but if you have already registered, you're going to actually see that pop up in your registry. The VFC reason is only required if this is a VFC vaccine. If it is, you're going to check the VFC box that says VFC reason, and then you're going to drop down and pick the actual reason it is a VFC. Now the allergies can be accessed on this order. If you go to the far right, you can click on that and that's going to pop the allergy box up. So depending on, again, whether we have it turned on in practice preferences or not on the order, it may automatically pop up. It may not pop up until you actually administer it. But if you want to look at it on the order and you don't have that turned on, then you can go ahead and click on the allergies and take a look at that time that you order it. And then the funding source is not required at this time. So when I go ahead and I click on New Order, it's going to go ahead and bring up my group relationships. So when we talked in practice preferences about the group relationships, we had the pediatrics, we have the adult, and then we have the drop down that's by the category, and that's where you're going to see the 2-month, 4-month, 12 years. You can also do a search all. Now again, we don't recommend, best practice is not to do the search all. If you do the search all, you want to make sure that you search inventory only. If you do a search on all vaccines, again, you can be picking a vaccine that you don't have an inventory built for, and then you're not going to be able to see the lot number to actually keep your inventory clean. So what we recommend is that you're using the pediatrics or the adult or the by category, and that you get these set up nice and clean for your practice so they don't have to go to the search all to find the vaccine that they're looking for. So we talked again about the Hep B, and if you look under the Hep B where it says the DTaP, the hemophilus, the Hep B, I mean, again, those are the relationships that are built. So there is some confusion sometimes if I'm just trying to do a Hep B, which one I'm choosing. So you need to make sure that you're looking at the CPT codes and you understand what these are under each category and that you understand the relationship to them. So you're going to go ahead, and if you find the vaccine that you're looking to give, you can go ahead and choose that vaccine that's desired. Again, the allergy may pop up or may not, depending on how you have that set in your practice preferences. If the allergies does display, you now have the ability to go ahead and click no to all allergies, and I think that was in UD1, where before in 5.8 you had to actually click no on each one of those. So if I'm just ordering it, I can go ahead and at that point, I can either save and task it to one of my staff members. So if your physician are ordering these, they can save and task it. and just hit save. So if you've got someone who's ordering it and they're just going to go ahead and complete it and administer it right at that moment, they would click save and then go right to the vaccine details. If you have a physician that's ordering that, they're going to go ahead and hit save and task, and they may task it to a nursing staff to come in and actually give the vaccine. So we're going to go ahead and look at the vaccine details as if we're going to go ahead and administer it. So once I go ahead and I go into the vaccine details, I may or may not get any kind of drug interaction. It's going to pop up. If you do get one of these, you need to acknowledge it to proceed. If you get multiple ones, you need to acknowledge each one of them individually. Once you do that, it's going to pop up your VIS display. Now again, whether we have this set to automatically print or display in my practice preferences, best practice is to have it pop up. Now you could print it from here, or you can just say document as given. So if you've got these already pre-printed and you're just handing them out and the patients, when they come in, you've given them, then you can do document as given, and then that's just going to document in the chart and put a copy into the chart. We talked about under your category, you're going to be able to go back and look at the VIS document was given. So once those displays go away, then my actual vaccine that I want to give at the moment is going to be at the top, my vaccine name. If there's multiple ones, they're all going to be listed here. It is highlighted. It is a very light highlighting, so it's almost just kind of a yellowish, kind of off-white color, but that is highlighted. So if you have multiple ones, you'll click on them. You need to click on the vaccine that you actually want to administer, and then you should be able to drop down to your lot number. Now your lot number will show, and this lot number is going to be linked to your location. It's going to be linked to whether it's VFC or not VFC. So you want to make sure, and it's going to be linked on whether you actually have the vaccine built in your inventory with the correct CPT code, the correct CVX for you to be able to see this. So if you're having issues and you're dropping down in your lot numbers and you're not seeing the lots that you think should be there, then we have to backtrack through your entire setup to see where that's missing. Was it not moved into your preferences? Was it not set up to do the billing? Was it set? So you just want to go back and look at why it's missing. So once I pick the lot number that I've got the vaccine in my hand, and I'm going to go ahead and pick the lot number that's on it. All my information that I built in file maintenance is now going to pre-populate for my clinical staff. They don't have to enter, the brand name. They don't have to enter the milliliters, the intramuscular, the NDC number. Everything is going to pre-populate for them. Now, if you look down at my brand name, because this was not a VFC, I actually have in there the DTAP, and then behind this I put the PF for private. So again, you can name them, PF for private or VFC. You don't have to do both. So if you only do VFC, but it is a visual that they know this is a VFC, or oops, I forgot to check the VFC box. It's another visual for them to just make sure that they're actually giving private versus VFC. And then the billing codes are going to automatically populate as well too. So you're going to see the 90700, and then you're going to see the admin code of the 90471. Now, if I choose the VFC, I'm only going to see the inventory that's linked to the VFC. It's going to require that I actually put a VFC reason in there. And then on the line with the actual vaccine name, it's going to list my VFC reason and a check mark for is this VFC as well. Now, it is not required to put the funding source in there. So then when I drop down to pick my lot number, I'm now only going to see the lot of my inventory that was built for VFC. And if you look at my brand name, now I've got my DTAP and I've got behind that VFC. So again, another visual that I'm making sure I'm pulling from the right lot. And then if you notice my admin code, it allows me now to drop down and say, I want my 90700 VFC. And that was the alternate SIM code that I built for that. But all my information, again, as far as my units and everything is going to pre-populate my NDC numbers, and nobody on the clinical staff have to enter any of that. So if I have a waste, that's the ins and outs of ordering and administering. So if you have a waste vaccine, so you've actually drawn it up and it's a true waste, you want to make sure that you report it as a waste to keep your inventory accurate. So if you've ordered it and it's not a waste and you don't actually even draw it up, then you can just delete the order. But if you actually order it and you go to administer and you draw it up and now, the patient refused or something changed or you dropped and broke it, you need to go in and actually record that as a waste on the patient's chart. And by doing this, it's going to keep your inventory accurate because it's going to reduce it by the one that you did not administer, but that is no longer in your inventory. So it is important to make sure that your inventory stays accurate by doing the waste as well. So if patients come in and they have historical vaccines, so you're trying to just update their records historically, you want to make sure that you just click on the historical button. And then you're just going to choose your vaccine. And when you choose the vaccine, it's going to go ahead and pop up. If I say influenza, the patient told me they had this, influenza vaccine, 4 months ago by another physician. I can click on historical, pick my vaccine that I want to enter. It's going to auto-populate my CVX and my CPT code. And again, this is not coming from your inventory. This is just saying the patient received this somewhere else. And the only thing that's required then is that you put a date and a source. And once you enter your date and your source, you can put some comments if you choose, some additional comments on where they had that done. But the date and the source are the only two that are required for entering historical vaccine or immunizations. So as we talked a little bit about exclusions when we were looking back on the relationships in file maintenance, you want to make sure that if you're excluding a vaccine that you've got all the relationships in as well. So if I click on my exclusion because I'm seeing some things that are past due on this patient, I don't have their historical data, so I can't actually enter when they had this Hep B, but I don't need it to show past due anymore because I need to just exclude it. Then I can go ahead and hit my exclusion button. And I have the ability then to check all, and it's going to exclude all the relationships that are under there. So any vaccine that pops up saying it's past due that is within this relationship are all going to be excluded. So another thing that we can do is if we don't have the historical information, but we know the series was complete, so the patient is stating this was complete, but you don't have the exact dates, you can go in and click on series complete under the Hep B, and I could go in again and check all or check which ones were complete. And then it's going to actually complete those and no longer show as past due because I've completed the series, but I don't have the dates of the historical information. So a couple of other tips within the workflow itself is free texting your lot numbers. Absolutely do not free text the lot numbers in there. So if you think your inventory is clean and your clinical staff is dropping down and they're not finding the lot, so they're just free texting in there just to go ahead and get it into the system. I mean, I say do not do it, but yes, they have to enter that. But what that is doing is creating your inventory to not ever reconcile. So if that's occurring on a regular basis, you need to go back and you need to really just do an overhaul, clean, create brand new inventory, and then make sure that are they on the right location. So I'm going to look at location. Location matters. So, if I'm at my Main Street office and all of a sudden I'm trying to give an inventory, but at the top of my EHR screen, I have that I'm at my Park Street address, I'm never going to find the inventory for Main Street until I change my location on that patient to the correct location that that inventory is at. So location clearly matters as far as if you're going to see the right lot numbers or not. But anytime somebody free text in a lot number, your inventory is off. It will never deduct that actual vaccine from your inventory. So then your inventory is incorrect at that time. So I want to look another thing real quick at the sub-navigation links because we went directly into the orders module and you have sub-navigation links. So we have the adult immunization and the peds immunization. So we often get asked, what's the difference? Does it matter if I go straight to the orders or do I come into the adult immunization or the peds immunization? It is going to take you directly to the orders module regardless. Okay, so you're going to see the same information on the orders module. You can order from there, you can administer from there. The only things that you're going to see differently is if you go to the sub-navs and you scroll down to the bottom, you're going to have a couple additional information pieces here. So you're going to have some web resources that you could go out to, but you've also got the child and teen vaccine questionnaire if you go on the actual PEDS sub-navigation link, and then you've got the adult vaccine questionnaire if you go on the adult sub-nav. So I popped up just the child-teen immunization, but there's just some questions on here. So if your physician's looking for the screening for the child-teen immunization, you need to go through the actual sub-nav to get to this, or that's the quickest way to get to it, but you won't see this on the bottom of the actual orders module. And then the last thing that's on the bottom of the sub-navigation link as well is if there's an adverse event report. So if you want to add, edit, or print a document, so if they get a flu and they flu shot and their arm swells up and they have extremely puffy red arm, you can go ahead and enter that on the adverse event report, and that's at the bottom again of the sub-navigation link. So now we're going to roll into the crystal reports. The crystal reports were all updated with a 5.8 version as well. They are in the NextGen root folder. So we talked a little bit about that distributed reports folder, your crystal reports folders in there. So you've got a report that's called the vaccine summary. Now again, that needs to be copied and moved over to your EMR report. So if you're having issues with your summary crystal report, your vaccine summary crystal report printing or not printing correctly, make sure you have the most recent updated copy in there. So you want to make sure that you do have it in your distributed report folder, you pull it over and then move it into your EMR reports folder. If you want to add your crystal report so that you have it saved in the patient's chart within the EHR, you can go into File. Actually, that should have been highlighted reports there. I apologize, not export patient documents. File, reports, crystal reports. And then under the all encounters for current patient, you can go ahead and just preview, go find your vaccine summary, and then save it to the chart if you want to save it to the chart. So then a copy is going to be saved to that encounter as well too. And then if you go ahead when you're in the orders module and you just actually click on the print preview, it's going to go ahead and show you that immunization summary report. So it's just going to be a summary. Now it is not in the grid form that it used to be in the template. I mean, there's a lot of, don't love it in this format, not as easy to read. It is the crystal report that's out there right now. It is complete with all the vaccine information on it. It's just not in the old format that the grid was from the templates. So if we want to add the new inventory from our Ngkbm immunizations, so if you have clinical staff that want to enter the new inventory that comes in and you don't want them in file maintenance, again, as long as it's an immunization or a vaccine that we have given in the past, we have built one at least within file maintenance within NextGen. We've linked everything that we want in there as far as my route and my brand name and my manufacturer and my NDC number within there. I can go ahead and add a new inventory within that system practice template. And basically when I pull up the Ngkbm immunization, it's going to pop up and I've got an example at the bottom of the screen. So if I would go ahead and highlight, on my HIB, it's going to go ahead and bring up my existing inventory that I have. So I have one right now with a lot number of my 56789 H17. And if I wanted to update a brand new one in there, what I would actually do is just go ahead, click that, pop it up, and then I'm going to go ahead and I'm going to put my new expiration date of my new order, my new lot number, my new starting units of this one. I'm going to go ahead and determine, is this going to my same location as my existing one, or am I going to change my location because this one's going to one of my other locations? And then I'm going to click Add, which is going to take this new inventory and add it to my inventory. If I click Update, it just changes the inventory that I chose, which is actually still an active inventory in the back. So by doing it this way, You know, you've got to make sure that people are going to pay attention, and then they're not actually going to update and then change a lot number of something that's already existing in file maintenance. So, you know, it can be done. A lot of people are doing it this way. You just have to make sure that, you know, they are not just updating an existing one and then all of a sudden you've just wiped out your units used and now you have a missing lot number. This does share fields with file maintenance, so if I do this and I would go back into file maintenance, it's going to show up there in my inventory and file maintenance as well if I build it through here. So thanks for hanging with me. We're getting close to the end here. Inventory reports and reconciliation. So the inventory reports, if I go into my Ngkbm immunization again, at the top there it'll have immunization inventory. If I want to go ahead and run my active lot numbers or my inactive lot numbers or my non-VFC or my VFC, this report is not pretty, but it will give you some information. So the first thing you're going to do is I'm going to go ahead and if I run it and I say give it to me for location all, that is not going to give me all the locations. It's going to give me any inventory that I built in file maintenance that I did not link to a location. Okay, so it's a little kind of misleading, but if you have inventory built, you've not linked it to a location, you're not seeing those lot numbers show up when you're trying to administer, run this report and look for anything that has location all, and then go back and update those and actually link them to a location. Because once you get that inventory in, you're going to deliver it to a location. You should be able to pick which location that inventory is at. If I want to run it and I actually want to look at my inventory for just one of my locations, I can at the bottom go ahead and say, okay, give me my non-VFC for my main office. I move that to right and I just go ahead and click OK. If I want to look at all my locations, it's going to go ahead and break them by location. Or I can again print just by one location and have somebody go back and look at the inventory. What you want to look at on these reports, again, it's kind of a manual process now at this point, is I want to go ahead and look at, I have an expiration date, but I've still got some units left. I've got some doses remaining and I've got expired inventory. You know, somebody needs to go pull that and deal with them based on your clinic guidelines. If I have a couple of inventories that have used all of their units, like this example. So I've got a couple of inventory now that my doses received were 25, but my doses used were 25. So I actually have nothing left. Okay, NextGen is not going to automatically expire these out, hide them, or make them inactive. And unfortunately, if somebody goes to administer, this Dapicel and I have no units left, if they drop down and choose that lot number, because the one they're looking at is off by one number and they're not paying attention, they can make this go into the negative. So by making this go into the negative, you've now used more doses than you actually have in your lot numbers and your inventory is off again. So if you run this report on a regular basis, once you look at something where there's a 0 remaining doses, someone in file maintenance needs to go back, make it inactive, and then hide it because you no longer want that lot number to show up or be chosen when somebody is ordering this. And same with my test flu. I mean, if I'm done and that flu's expired, I need to go in and update my inventory. There's no easy way at the moment to do this. I know that, there's some people looking at SQL and stuff, but right now it is a manual process of taking a look at this, making sure that you make them inactive if they've expired. If you have remaining doses, somebody's going to take care of them based on your clinic guidelines, and that you want to make sure that that lot number is no longer available for somebody to choose. A couple more things, MAP vaccine. So I just quickly wanted to let people know, if you're still seeing when you're running reports, if I run that summary report and I actually see unknown, you need to go back and you need to make sure that you map your vaccines. So this goes back to, in the template, the CVX codes were not required, so you may have given a DTaP with no CVX code, and then it's not going to map that actually to DTaP. But if you go in and run this KBMNG utility map vaccines, you can go ahead and map those so that they actually will fall then underneath the DTaP on your summary report. And then quickly through the administration codes and billing, There is a lot of discussion right now on admin codes and the proper billing with it. My best advice is you need to be looking at your denial codes, and you need to contact your carrier. If you're giving multiple component vaccines and you're billing with the multiple component codes with the 2 units and you're not getting paid, contact your payers and work through that with your payers. There are separate codes based on the vaccine administered with or without counseling. You want to make sure that NextGen is actually, if you click on counseling, it's going to build the right code for you. So if you're having problems with denials with that, and then again, just look at your multi-components. So what I've noted here on the last 2 slides is, just a little bit of information about the 90460 and the 90461 codes, and then the 90471s and the 90474 codes. A little bit of the explanation of how they're used, and again, if you're in NextGen and you actually have everything set up correctly, it's going to pull your admin codes for you correctly, unless you've altered those in the setup and file maintenance. And then there's just a little administration kind of example of an 11-year-old girl if you want to take a look at that as well too. And then at the very end here, we've got the ICD-10 code, so we're going to end it A to Z, administration all the way to Z. Z23 is our new vaccine code. With ICD-10, what they did was recognize that the type of vaccine you report with a CPT or your HCPCS codes give them sufficient detail about what type of immunization is. So rather having every provider have to choose a diagnosis code, we now have Z23 for all of our immunizations. So this should be loaded in file maintenance. If you had any old history inventory built prior to ICD-10 go live, you want to make sure that you've actually updated your ICD-10 codes, and that was through the Ngkbm utility. So if you still have some old vaccine codes out there with the ICD, some vaccine inventory out there with the wrong ICD-10 code or the ICD-9 code in there, make sure you run that utility and get the correct code in there of Z23. And then just also here, with the medication update, if you're looking for a vaccine or an immunization and you're unable to find it, make sure that you're doing your medication updates on a regular basis and you have the most recent version in there. And a quick, easy way to check what version you have is just go into EHR, click on your help and then about NextGen, and it's going to list your medication version 03215. If you've got an old version in there, you are missing some of the vaccines and you are probably unable to even build a clean inventory. So next steps, that's a lot of information. We'll get to questions here in one moment, but visit us on itenov.com. Sign up for any of our informative webinars or our blocks. We do have a 3-day fixed price on-site consultations. If you're unaware of that, we do clinical workflow, and then we'll do some revenue cycle and front desk workflow analysis. If you're having any issues or pain points in those areas, we will come on site for 3 days for a fixed price and do a complete full evaluation and recommendations for you, as well as technology and performance issues. If you're having, we'll do the same thing, come on site, bring one of our technicians on, and they will go through and look at all your performance and then give you any NextGen recommendations on that, or test drive some of our products. Chelsea,
hey, Jeannie, thanks so much.
Open it up, yeah. Open it up for questions.
Okay, just a reminder, you can enter your questions in the questions area of the webinar control panel, and I'll read them aloud, and Jeannie and Sue will answer them. So the first question, I need to see the workflow from EHR to EPM Q codes. We can get it to work in EHR, but when it gets pulled into EPM, the regular CPT pulls to the claim instead of the Q code. And if you look in the charge screen, it shows the regular CPT code matched to the Q code SIM.
Okay, so if I understand the question correctly, it is pulling the correct CPT code in EHR, and then if I pull in bring my charges over from EPM and accept my charges, I still have the correct CPT code on my charge screen, but then when I print my claim, I'm getting the wrong code. I'm assuming that was the full question there. We would have to look on that on there, something triggering in the back based on maybe even payer or that SIM code that is saying in this scenario use an alternate code, because if it's crossing over from EHR correctly, then it's probably built correctly in file maintenance, and it's actually pushing it through. So we would need to really look at the payer and anything else that you would have saying, use an alternate code for this. So Chelsea, if we can get that person's information, I can probably get a little more information from them and get back with them.
Okay, thanks, Jenny. Next question was in relation to some slides that were about 20 minutes in, and unfortunately I didn't write down what slide that was. We might have to get back to this person as well, but it was...
she was referring to the Options tab in the setup.
And it was, do we use this area for the diluent?
If that is a combo, okay, so if that is a combo drug that they're mixing multiple drugs in, then yes, the option tab would be that you're putting the lot numbers of anything that you're going to mix together in there, correct?
Okay, next question. We're updating GUD2 next week. Are there any pitfalls or problems that we should be ready to deal with?
To my knowledge, as far as anything with immunizations, no.
Okay, great. Next question. We have over 50 different offices. It scares me to give all of them access to enter their own vaccines. Is it better to have 1 or 2 people do it for all of the offices?
Sue may have a little bit more with this one, but to me, if you want to keep control of it, then I would say yes, that you would definitely want somebody to be your inventory control officer, or 1 or 2 people that would control that, because again, you can see there's a lot of moving parts, and if one piece is not done completely, then you're trying to backpedal and figure out exactly where something went, awry.
Yeah, I agree with that also. The one thing that I have heard though is that in some ways it's easier to have your clinical staff entering this on the system practice template because they've got the vials there, they've got the boxes, they've got the vials, and that's a valid issue also. But if you're a large practice and you'd have to parse this out to 50 different people, I wouldn't do it. I'd be afraid too. I think you're very, very wise. I would be very afraid. So.
Right, and that's where we did say under the system practice templates, it's easy to add it once you've got one set of inventory that's built clean in file maintenance. You just want to make sure you use that add button, not update. Correct.
Right.
Okay, when using the inactive box and hiding the vaccine, I went back and excuse me, let me start all over with that one. When using the inactive box and hiding the vaccine, I went back in and the status still shows as active. Can you go over this one more time, please? Thank you.
That is correct. Okay, so all of those that came over from your historical immunization, so your historical lots and everything that you had before, are all going to show active on that very top line. So they're going to show active, and then like my example showed active, but then the CVX number was missing even though it said active. Now by clicking my inactive box now and hiding it, it's never going to change that top line that says inactive. It's just no longer going to be in my inventory for anybody to choose in the orders module. Okay, but it is not going to change that top line. That's why the historical information that came over it's almost better to just make it inactive, hide all that, and start with a brand new clean inventory.
Okay, great, thank you. Next one. When our staff are entering the historical vaccines, NextGen is creating an encounter for the date the vaccine is given and creating charges. We then have to go in and delete the encounter and the charges. What's causing this? How can we prevent this from happening in the future?
Have you seen that where it creates
no, that should not be happening. So either there is something in terms of your setup that's not, that we need to take a look at, or if you're sure you're entering those in the historical section in the order module, something's wrong. That should not happen. So either there's a setup issue or, you know, possibly a bug. But the next place I would look would be to look at setup, as long as you're sure that those vaccines were entered in the historical section and not as a new vaccine.
Not ordered, correct. Not ordered and then just completed. They have to go in that historical, but I have not seen that either. I've not seen
Yeah.
we have a lot of people entering historical, and I'm not seeing that either.
Right.
Okay, next question. If we do the setup in our test environment, can it be moved to prod? I assume this can be done via SQL, but I wonder if scripts are available for this function.
Yes, it can be done. And we did that with a lot of our clients when they were actually first doing the, you know, weekend of the 8.3 go live, whatever version they were going on. And yes, we built everything in their test database and then just ran a SQL to run. So yes, it can be done. I don't have a script that I can hand out for that, but you can contact us. But yes, it has been done with many clients.
Okay, thank you. Next one. With the inventory report, can we set it to run automatically, maybe every night, and have it stored or emailed to a staff member?
That would be awesome.
This is someone on the EPM side who thinks things can happen automatically.
That would be awesome, and the goal in the future for some of us is, yes, as of right now, there's not even a way. If you go into file maintenance and you want to, if you do the right click and print, like we can do many things in file maintenance, right click print, export that out, take a look at it. If you right click print right now, it's going to tell you that report is not available, so you can't even right click print. So there is no way for us to run through the BBP saying, hey, go grab this report and email it out to anybody, because we can't even get that to print out. So with some SQL or manipulation, there's probably a way to do that, but not just with the system itself right now.
Bummer. Next question. Next question. Is it absolutely necessary to inactivate an expired vaccine, or does hiding it be enough?
No, you must do both. You want to do both, hide and inactivate.
Yep.
Okay.
If you don't hide it, if you don't do both, your end users will still be able to select them, and that's exactly what you don't want to happen.
Okay, thanks, Sue. Does NextGen have a similar inventory tool for medications?
I'm not sure I understand the question, because this is all direct. I'm not sure I understand the question, because this is all directly from NextGen. So the inventory tool that, I mean, basically I ran just that report. It was just kind of, you know, very generic information, just kind of told me what was the units I needed to go back and do anything, but there's no true inventory tool.
Okay, so Simone, if we didn't answer that one well enough, feel free to reach out to either Jeannie or Sue up here, and we'd be happy to work with you on a better answer for that question if we didn't answer it. Will the link for today's presentation be posted? It sure will. Like all webinars, we send out an email to everybody who registered for it. It'll probably be tomorrow. Usually it's the same day or a day later after I get the recording uploaded. So we'll send out an email with a link both to the recording as well as to a PDF copy of the slides. And you can access all of our previous webinars in the Events and Education section of our website. So visit us there for any past ones, and by tomorrow this one will be up there as well. Does a NDC manually entered get pulled onto claims forms?
Yes, but it's two-part. You need to enter the NDC in your inventory, but you also need to have your NDC number linked to your SIM code.
Can you please go over how the quantity correlates to the starting units. How does NextGen count units used from multi-dose vials?
So with the inventory with the multi-dose, so if I have a DTaP and it's 3 components, I build my inventory. It's just 1 vial, okay? So I think the question is not how that drops down, but if it's the mixing my own and I've got multiple and then I'm mixing my own, how that's dropping down. So it's kind of a 2-part question, I guess, with this on. So if I have a DTaP and I've got 3 components to it, and I put the 3 components in, when I give it, it's still just 1 vial, so it's going to drop it down that 1 vial was used. So that's going to take care of that. As far as if you're mixing your own, I mean, we would really have to look at when you add those additional lot numbers in there, it should be deducting from each one of those lot numbers of that parent child. So basically, I'm building a parent of what I'm mixing, and then when I use that, it should drop each one of those child inventory down. I hope that answered.
Okay, Donna, so if that wasn't your question, let us know, and we'll get back to it. Once a provider has ordered a vaccine, can the nursing staff who is administering change the CPT of the vaccine?
You would not want to change the CPT of the vaccine. If they're ordering it and the CPT code is the wrong vaccine, then you're going to, again, go all the way back to your inventory that's built. You're going to make sure that you're picking the vaccine from your data bank, which is your med update list, that it's got the correct CPT code there, because each CPT code then correlates to the correct CVX number, which correlates to the correct NDC number. So if when you go to order it, it's the wrong CPT code, then you've got something built on the back end wrong, or it's the wrong one is pulled over into your practice preferences. So you need to go, I mean, there's multiple steps there to backtrack it, but you would not want to change it on the order.
Okay,
Sue,
thanks, Jeannie.
I was going to say, Sue, do you have any other comments with that? I mean.
No, I agree. Totally agree.
Okay, it looks like we have one more question. Just a reminder, you can always reach out to us with the information you see up on the screen, or you can reply to my email tomorrow when I send out copies of the presentation. And you can always find us on social media. You can ask questions there. We do tech tips every week, sometimes a couple of times a week. Most of them are NextGen specific. So you can find us everywhere. So feel free to follow us, join us, like us, all that. Next question. How do you keep old vaccines, like last year's flu shot, available for historical entry, but not available to be ordered today?
Well, as far as the flu vaccines, I mean, if it's historical and they've had it ordered somewhere else and administered somewhere else, that's not going to come from your lot number. So they're still going to be able to just go out to the data bank and pull, you know, last year's flu or 2 years ago flu. If you're just entering the historical, it's not actually coming from your lot. So it's still out there as far as in the data banks to pull for historical information. So you just have to kind of remember that historical vaccines, when you're entering that, is not pulling anything from your inventory. So you may never have built that flu vaccine in your inventory, but you can still document historically that that patient got it by, again, just going out. It lets you drop down and go out to the data bank to pull any immunization available. So once your vaccine, your flu vaccines have expired, you want to go into your inventory and you want to inactivate them and hide them.
Okay, looks like we have another question about multi-dose again. Not mixing your own. How does it handle multi-dose quantities? Example, instead of 1 vial, you would draw out 10 milliliters. There's no mixing involved, though.
So if you've got multiple vials that you're just drawing out of, then those should be their own individual inventory. So you would have a lot number for each vial that you're drawing. So when you order it, you would be ordering both of those. So they would be separate lot numbers. So then when you're actually administering, you would have each lot number, each vial. So again, if it's separate vials that you're drawing from, each one of those would have their own inventory, their own lot number. So then it would deduct.
No, I think that the question is saying if you can, Sue, do you understand?
Are they asking about the quantity field in the vaccine record? Is that
Hang on,
what
let me
they're
reread the
asking about?
question.
Okay.
About multi-dose again, not mixing your own. How does it handle multi-dose quantities? E.g., instead of one vial, so instead of a full vial, you would draw out only 10 milliliters. There's no mixing involved, though.
Is a 1 vial dose normally, is that the normal dosage? Would you normally give the whole vial? I'm not sure I understand what the question is.
Because I mean, I guess the thing is like when you're using things that are not vaccines or immunizations, so you may be giving somebody a partial, like 10 mils out of a vial that's, you know,
Yes,
40 mils,
I think that's
you're
the
eligible
question.
at 10 mils out, but that's not how your vaccines or immunizations are. They're just kind of a one-to-one. So if I'm missing that, I mean, definitely, Blair, reach out to us if we're missing the understanding of this one and what you're actually giving, and we can kind of dig a little deeper on that.
Okay. Next question. Can you default the VIS language to something other than English?
Yes. In the VIS setup, you can choose which one you want as your default.
Okay. Well, we'll give everybody just a couple more minutes. If you have any questions, there's no wait, so ask them now. Otherwise, thank you everyone for coming. Thanks, Jeannie and Sue, for taking the time to do this presentation and put it together. And Happy New Year. It's the first webinar we've had this year.
Thank you, everybody, for attending, and I knew this was going to be a little bit long, so thanks for hanging in there.